in this section, we're going to talk about the bones that make up the rib cage or the thoracic cage. Doesn't matter whether you're male or female, anatomically you have 12 pair of ribs. Those ribs are divided into true ribs and false ribs. We'll talk about those in just a second. The ribs articulate anteriorly with the sternum, and here we see a sternum removed, and posteriorly they're going to articulate with the vertebral column, with the bodies and transverse processes of thoracic vertebra. But let's first talk about the sternum and ribs attachments to the sternum, as well as how we tell a true rib from a false rib. The sternum is actually divided into three regions. It has an upper region known as the manubrium, a main region known as the body, and then a small pointed process on the bottom known as the xiphoid process. Now in this particular bony sternum, the xiphoid process has been chipped away. So on this articulated skeleton, we can see the manubrium, the body, and then the xiphoid process. The very top of the sternum has a notch, and you can feel that in your own neck. Some books call that the jugular notch. The correct anatomical name is the suprasternal notch. So the suprasternal notch is on top of the sternum and actually located between the 2 points where the clavicle articulates with the sternum. Remember, we started with the clavicle, so on this particular skeleton you can see the clavicle articulating with the sternum. Not as easy to see, but the second rib coming into the manubrium of the, or excuse me, the first rib coming into the manubrium of the sternum. Now this sternum shows something that we don't see real well on these plastic articulated skeletons. Where the manubrium and the body of the sternum meet is an anatomical landmark known as the sternal angle. Very important anatomically for many reasons. If I turn this sternum and you look at it from a lateral view, I think you can see why this area right here is known as the sternal angle. There's a definite angle change in the bony structure at this point. The sternal angle, anatomically very important. The second rib always articulates with the sternum at the sternal angle. So if I look at this particular articulated skeleton, I know right here is my sternal angle. I know this must be the second rib. Now this comes in very handy in clinical practice because you can always feel the sternal angle. It doesn't matter how obese a person may be, you can feel their sternal angle. So if you need to count ribs for various reasons, if you want to place your stethoscope in a particular intercostal space to better listen to heart sounds or lung sounds, or if you're in need of putting in a chest tube in the emergency room and you need to count ribs so that you know that you're inserting your tubes in the correct place or placing your stethoscope over the correct intercostal space, you can always count on that sternal angle to be rib 2, and then you can calculate from there. Also, when we get inside the body, the superior border of the heart is just inferior to that sternal angle. The great vessels are entering and leaving the heart at the sternal angle. The trachea bifurcates immediately posterior to the sternal angle. So many anatomical landmarks associated with that sternal angle. Now ribs are associated, I said, with the sternum and the vertebral column. Very important for our mechanism of breathing. Ribs, I said, 12 pair of ribs, and here I have one particular rib. Ribs are divided into true ribs and false ribs. True ribs meet with the sternum, and I shouldn't say they meet with the sternum directly. Ribs have what are called costal cartilages. So here we can see on this articulated skeleton in the brown color the costal cartilage from rib 1, rib 2, rib 3, rib 4, rib 5, rib 6, and even from rib 7. Those costal cartilages go directly to the sternum. Again, 1, 2, 3, 4, 5, 6, and 7, going directly to the sternum. That is our definition of a true rib. If their costal cartilage articulates with the sternum directly, they are a true rib. If their costal cartilage does not go directly to the sternum, they are considered a false rib. Notice that the costal cartilage from rib 8 does not go directly to the sternum. It goes into the costal cartilage from rib 7 and continues to the sternum. 9 feeds into that from 8. 10 feeds into that from 9. So true ribs, their cartilages go directly to the sternum. That would be ribs 1, 2, 3, 4, 5, 6, and 7. False ribs, their costal cartilages do not go to the sternum, but rather they go into the costal cartilage of the rib immediately above them. So 8 goes into 7, 9 goes into 8, 10 goes into 9. And then we have 2 more of the false ribs, ribs 11 and 12. Ribs 11 and 12 are considered false ribs, but they are also considered what we call floating ribs. They do not have a costal cartilage that it attaches to the sternum or the other costal cartilages. So they are floating ribs. They are suspended in the muscle mass of the thoracic wall. Keep in mind, ribs 11 and 12 are floating ribs, but they are also considered to be false ribs. So ribs 1 through 7, true ribs. Ribs 8 through 12, false ribs. 11 and 12, a special subset of false ribs known as floating ribs. Now how can we tell from which side of the body a rib was taken? Here I have a rib. Notice this rib is not a flat bone. It is arched, but it's arched three-dimensionally. It curves this way as well as this way. So it has different curves to it. The ribs have a fairly flat anterior surface where it fused in with the costal cartilage. Posteriorly, they have a small head, then a very short region known as the neck, and then a lump known as the tubercle. So we have the head, the neck, and the tubercle of the rib. Then the rib takes a sharp turn to head around. That is known as the angle. And at the angle, if you look carefully, you can see a groove underneath the rib called the costal groove. Some books incorrectly call it the subcostal groove, but in a way that can be helpful for the student because they know sub means under, subcostal would mean under the rib. So although the term subcostal groove is not anatomically correct, it can be helpful to the student in learning how to place this rib. The head of the rib articulates with the vertebral column. So if we look at the cadaver to my left, the heads of the ribs are articulating in here with the vertebral column. The tubercle of the rib is articulating with the transverse process of the vertebra, and then it circles around to form our thoracic cavity. So for me to determine if this is a left rib or a right rib, I simply need to put the head in the back and the groove down. In this case, this would be a right rib. Now when we learn about mechanisms of breathing, we can see that ribs, we know when we breathe, ribs go up. So there is what's called the bucket handle theory of breathing, and you can see how this looks sort of like raising the handle on a bucket. And there's a pump handle theory, where the rib also does this, sort of like the pump, the handle on an old pump. So that helps explain why the three-dimensional curves to the ribs. So again, to tell a left rib from a right rib, simply put the head in the back and the costal groove downward. And that will tell you left versus right.